Hi, GM. We are streaming live from day 4 of India AM Impact Summit. Once again, I have Dr. Datta with me.
Hi.
Thank you so much, sir, for joining. For people that might not know you, can you share a little bit about yourself, sir?
Guys, I am a physician scientist, and you want me to hold this?
No, that's fine.
Okay, cool. I'm a physician scientist at Ashok University. I work at the Koita Center for Digital Health. I did my undergrad in JIPMER, my MBBS there for almost 5.5 years. Then I shifted to Delhi. I joined the All India Institute of Medical Sciences. I was there for almost 5 years, did my residency in radiology, and then I did my senior residency for 1.5 years. Now I have joined full time to do AI research at the Koita Center, where I also lead a small research group called the Center for Responsible Autonomous Systems in Healthcare, or Crash Lab, as many people know it.
Perfect. Absolutely. So, can you share about all the research ventures that you all are working at the Crash Lab?
Right. In India, we have a lot of problems which need to be addressed, but a big problem is data. We have divided our work into four verticals. The first vertical looks at how can we create the data commons and the data foundations. So we're working with different institutes like NIMHANS, Tata, and other people to work with them to create data sets which are structured, organized, and also we are working on the second vertical, which is essentially creating the benchmarks and standards for India, in which we look at different AI models which are already flooding the markets, and how can we standardize them, how can we evaluate them, and how can we also see whether these ambient scribes and other AI models in the market are really useful or not, and whether in the real world they are making any changes which we want them to make. So that's the second vertical. The third vertical, which we are working with NUS and other players, are to develop AI models, which are novel architectures developed from India. And the fourth one is something which we have just started last year, developing agentic workflows, but also responsible, reliable workflows, which we can evaluate and pinpoint where they're going wrong in case they actually
Go wrong.
falter.
Yeah,
Yeah.
absolutely perfect. I think so. You being a radiologist yourself, I think there's a lot of talk going out, right, that AI would replace radiologists the first. So, if you had to comment on this, that AI replacing doctors and AI replacing radiologists the first, what would your thoughts be?
See, I think the most cliched line which everybody has heard is that radiologists using AI will replace the ones who are not. If you have to look at it from a very forward-looking perspective, let's say 10 years, 20 years on the line, and I cannot pinpoint a timeline, but most of the things which we have seen in sci-fi movies often come true. The only thing which we are unable to predict are the timelines in which they come true. So I think there will be a time in which clinicians might feel that the AI models are at such a level that they are giving better diagnosis than their average radiologists. So it might happen that they start relying upon AI tools with, let's say, 100% accuracy, if we are ever able to achieve that, and just defer the really complicated cases to the radiologists wherein they have some doubts. So in that case, the radiologist as a radiology as a job is not going to go away, but what is going to happen is that the significant less number of cases which we see, which might decrease the need for having so much radiologists, but at the same time enable us to reach out to a much larger amount of patients. At the same time, there are different newer fields like interventional radiology and preventive radiology which are coming up, and these will open up new workloads for radiologists. And I am very sure that the current batch of radiologists who are there in the country will have enough work for the next decade at least.
Perfect. So we are not getting replaced for the next decade at least, right? So, sir, I think Elon Musk actually said that in 2030, he's planning to replace all the surgeons at least. So, do you mind commenting on the surgery part as well?
Yeah, sure. Surgical AI tools actually are trained in a very different way, and for now, I'm very sure that in the next 5 to 10 years, that's not going to happen. Not because the AI will never be better than human beings, but
Yeah.
because of two reasons. One is compliance. You will never get a compliance to work independently on a patient. Even if a robot is finally doing that, something we call as vive surgery, we will actually find out that it will be guided by a surgeon who is an experienced one,
Yeah.
and because of that, probably the surgical time will fall, the amount of blood loss happening will decrease, the amount of degrees of freedom which a robot has is always more, right? and which you have seen in prostate surgeries through these robotic surgeries which are happening. But what is not going to happen is that surgeons being completely removed at least in the next 10-15 years, because compliance will not allow that, and I'm very sure as a patient you also will not allow a completely autonomous robot to do a surgery on you
Yeah.
without any surgeon overseeing that robot.
No, absolutely, absolutely. I think the last question to you would be just that. Any last tips for someone that is building AI in healthcare? What are the biggest problems that you personally feel?
I personally feel that most people building in healthcare do not know the problems correctly. You really need to sit with the clinicians, if clinicians are your end users, to see whether the problems which you are trying to solve for them are really something they would want to pay for,
Yeah.
right? Otherwise, we are ending up making solutions for the US market and nothing is happening in India. We need to build for India because there are real problems in India. And I think it gets solved if you start your journey by sitting with the clinicians and working with them, because they themselves help you address the correct problems. You can always figure out the engineering part, and also that clinician becomes your champion clinician who helps in distribution of your product as well
Yeah.
by showing to their colleagues. That's number one. And second thing is, I think essentially a lot of these AI tools are going to become very common, and it's a huge market. There's absolutely no doubt about it. Especially if you're looking towards building for patients, I think that's a good way to start any B2C business in the patient side. But make sure that you are following all the compliance laws, because if you do not, and if you capture patient identification information, you will be not following the laws of the land, and that can get you in trouble.
Yeah, absolutely. And I think one last thing before we end this space is that a lot of people, even ChatGPT, I think they have launched their new models. You know, so do you think large language models and GPTs are also helpful for maybe psychological disorders or maybe psychiatric diagnosis? Or I mean, should people, general people, should they be using them to kind of try to diagnose or try to find what's wrong with them?
Right now, today, no, definitely not, because there are a lot of cases where they falter. Going forward, I think mental health companions or AI companions for mental health are going to significantly help out people a lot.
Yeah.
There will be pros, there will be cons, but I feel that the pros ultimately will outweigh the cons once a certain level of accuracy is reached by these mental health companions, which will take probably, I would assume, at least 5 years.
Serious.
Yeah.
Perfect. Thank you so much, sir. This is Dr. Datta, and thank you so much, sir, for joining.
Thank you, Yash.
Thank you, sir.